I think I'm audible now, ma'am.
Yes.
Yeah. So just wanted to thank everyone. Thank you, ma'am. Thank you to the chairpersons, to the panelists, and it was really great to be learning from all of you. It was a very valuable session. We would now want to move on to our next session, which is the new essential tools for aesthetic treatments. This session is chaired by Dr. Madhuri Agarwal and Dr. Manish Gautam. Over to you, ma'am.
Hello all. So welcome to this exciting session about new technologies. And I would start with a little brief introduction of this technology. I request our technical team to play the video, and then we move on to our talks. Primelaze again is a well-known company coming up big time in India. I have used a couple of its technology, and I'm very proud to announce our esteemed international faculty today, Dr. Mario Trellis. He's an MD, PhD, a doctor in medicine and surgery, general surgeon, plastic, aesthetic, and reconstructive surgeon. He is having a roaring practice in Jumeirah, Dubai, and he has authored multiple papers. Sir, I have followed a lot of your work. I'm a big fan of your work. And he has an Indian association. He has been invited as academic lecturer and instructor in Pune at Mangeshkar Hospital, Department of Dermatology, and at Calicut and Chennai Universities, India. So over to you, Dr. Mario, for the talk.
Ma'am, I believe there's a technical problem with Dr. Mario's ID.
Okay, so till we sort that out, I would request next speaker, Mr. Fernando, the CEO of Milesman, to start with the introduction of the technology. It's an exciting technology, the blue laser called Blauman, and I'm really looking forward to trying it. So over to you, Mr. Fernando. Please share with us how did this laser come about, and then we'll have Dr. Mario to say a few words.
Hello, thank you very much. Welcome to everyone, and thanks for being here. Hello from Spain. I'm Fernando Diaz. I'm the CEO of Spain, of Milesman. So what we are going to talk about today is about the blue laser. Blue laser, it's a really revolving technology that is coming into this market. It's for sure, we think that it's going to be like an essential tool for dermatologists in the near future. It's a really new wavelength. I mean, it is new in itself because the blue laser, the 445, 450, that is the argon laser, it's present in the market for more than 40 years. But it is true that since 2017 or 16 is the first time that we really have powerful blue lasers. And when we say powerful blue laser, we are talking about having like 10 watts or 20 watts. With this, we're able to treat different lesions, pigmented lesions and vascular lesions. The blue laser, it's a very unique wavelength because it's the one that is the most absorbed by the oxyhemoglobin. It's also absorbed by the melanin, but it's not absorbed by water. This makes the laser really, really special. We knew about this technology. I mean, Milesman is present in the laser field since 1998, and we launched our lasers in 2007. And so we try to be very watchful of what's happening on the science.
thank you for that fantastic input. And we are very happy that the people will learn more about this new technology, and they will be definitely looking at as a good prospect for the future. And they will definitely be interested. Now we'll move on. Move on to our. There's still an issue with Dr. Mario. We're still not able to get him on it. So I would request Dr. Anurag Tiwari, next speaker, to take over from here. And it's always a pleasure to introduce a dear friend, colleague, and a fantastic dermatologist and a laser surgeon, Anurag Tiwari. And there are, amongst many things, he is like one of the persons who has got multifaceted approaches, and he's always a little bit of an innovator in most of the technologies, and he tries to work out with the technologies and move ahead with this. I'm sure he has got something fantastic here for us, and it will be something for everyone to take home. Over to you, Anurag.
Thank you, Manish. Hi, Madhuri. Thank you very much for getting me on board to Pigmentarycon. Fantastic conference, and I'm sure it's going to be a great, great success, and you'll set new parameters of success in virtual Congress.
Thank you.
So, all the best to you. Well, it has been an interesting session. Unfortunately, we could not hear Dr. Mario telling us about the clinical usage of the machine, which I also very much wanted to learn about, because while going through this technology, I found that it's a very, very innovative, nice, compact machine, which probably would help, which probably also has a smaller learning curve, because now what is happening as we see technology growing up, we see the learning curve has gone up. The newer people who started practicing recently have take a little more time to learn technology. So I feel that this machine could actually fill in that particular area, which is a nascent area here. So Dr. Fernando is there online. Dr. Fernando, Mr. Fernando.
Mr. Fernando, can you join us, please?
Yeah, I'm here.
Yeah, so I guess it's the two of us. So we were supposed to have a chat between the three of us. So, well, 2 is a company, 3 is a crowd is something which I try to remember. And let's try to understand more about your machine, and let's try to understand between the two of us how we can help people to understand more about the machine and get more users in the country. So you gave us a very interesting insight about the technology per se. Well, let me ask you one question straight on. Why and how did you narrow down to this particular wavelength, the 450 nanometers? How did it come to your mind, and what was the evolution of this machine?
Wait a minute, because Dr. Treyes is contacting me right now, and we're gonna try to connect with him. Okay.
All right.
So just, if you can give me 1 minute.
Yeah, sure. We can wait.
Anurag, in the meantime, I was also reading, me and Manish were just discussing the technology.
Yes.
And it seems pretty interesting because they are talking about, clinical usage in pigmentary and vascular lasers.
Right.
So I know you have a rich experience with laser. What are the current lasers you normally use for any pigmentation or vascular lesions for that matter? Do you use any currently, and do you find them good?
Well, Madhuri, we are spoiled for choices in treating epidermal lesions. We are spoiled for choices in treating pigment lesions. We have the Q switch, we have the conventional Q switch, we have the picosecond now. So we have a lot of lasers for pigmentation. We have the carbon dioxide, we have the erbium. These are the 2 most common. We have, of course, the good old electrocautery. We have got the RF machine also. So these are all the technologies which we are using, and I have all of them in my clinic. And depending on the scenario, what I want to use, I mix and match. The thing is about this particular laser, if I'm talking about this laser, the more I'm reading about it, A, it's a very compact machine. B, it has got a limited depth of penetration for the superficial layers. So I'm a little excited about this particular technology. I'm excited about this technology. As far as the vascular lasers are concerned, well, the biggest of them all is the PDL. We know that, but PDL is super expensive, super difficult to maintain. There are very, very few PDLs which are working in our country. Actually, I find it sometimes I don't own a PDL because the ROI, I'm a private practitioner. For me, ROI is important. So maintaining, a lot of my friends who are into private practice, sometimes they tell that the die of the PDL expires before they get enough number of patients. So maintaining a PDL in a private practice is very difficult. But of course, if this laser is going to treat the vascular abnormalities, not only the cherry angiomas or the very, very superficial ones, then it is a technology to look forward to. That is why I wanted Dr. Mario to be on the line, and I would have gathered a great amount from his experience.
Yeah,
But,
Yeah, I think he's joining us. He's joining us because there were some technical problems and he didn't receive the invitation. But we forward the invitation right now, and I think he's going to be here with us. I hear he's.
He's here. He's just joined us.
yeah.
So Madhuri, how much time do we have now? How much time do we have left?
We have around half an hour to 40 minutes.
Okay, so do you think that we can continue with Dr. Mario's lecture and then?
Yeah, I think that is right. We should have that first so that there's a nice.
Yeah, we'll have a continuation of thought process.
I'm sorry, Dr. Trellis has started sharing his screen. I think he's here.
Yeah, please go ahead.
Welcome, Dr. Trellis, and we're looking forward to your talk.
No.
Yeah, but
okay.
not in big format, eh?
Not in big format. So do it with the small format if you want. But we have to do it quickly because we are running a very short of time.
Yes, I will try to go on small slides, but I don't know if it's people are going to be capable of reading what I have written. Anyway, this device in principle was addressed to treat acne conditions of the skin. The different acne, especially those inflammatory lesions. Can you listen me?
Yes.
Can you hear me?
Yes.
Okay. However, because of the capabilities of modifying the different parameters of settings of the device, we found out that it was possible to do several treatments with it. Important is that the slide that I'm showing with my mouse here with the arrow is that the light in which this device emits enters very little in the skin. Being a blue light, stays on the skin surface. The first layers of epidermis are irradiated, and because of that, then this laser works specifically there. And you can use it. At the beginning was the idea to open those pustules of the acne in order to blast it in and also to disinfect the hole in which the infection was seated. However, we found that by modifying the parameters of pulse duration, also frequency of pulses or repetition rate of pulses and the power, we could play a very enormous applications, a list of applications. And because to a certain point, can you see now the slide a little bigger or no?
Yes.
Yes. Now it's good.
Okay, now it's good. So probably was some time that it needed the computer in order to adapt to the necessities of the session. Anyway, as you know, those using the laser is the wavelength, which means the wave of emission of the laser is very important in order to attack the chromophore in a specific one, because one of the qualifications of laser is that it's a device which is very selective. We are trying to do a very perfect confined effects of heat, of the energy of the laser stay in the target, and therefore respecting very much the surrounding tissue in order for the tissue to have chances to recover very fast. But at the same time, depending how you program your laser, you can get to different modalities of action of the laser, being three the important ones: the cutting, the vaporization, and the coagulation effects. You see, with the same laser that I use as an example, because this is the most common laser in medicine used by dermatologists, which is the CO2 laser. Depending how by focusing the laser, I can cut, but if I defocus, I can go for a coagulation action or do a vaporization. In these three different pictures of before and after, you can realize that being a laser that in principle is for cutting because it's absorbed by water, but just the focusing and leading heat or bringing heat to the tissue, you can actually produce coagulation. This is an enormous cavernous hemangioma, and this hemangioma was occupying all this part of the teeth of the mouth, and then also need not permit the young lady to close her mouth. This is a rhinophyma which is also being vaporized in order to do that. But when we go to see the effects of the Blauman laser, you can actually do all these three actions of lasers. With this 455 nanometers diode laser, being the Blauman laser, the cutting effect is possible. But because there is no chromophore, which is in principle the chromophore of the blue light is the melanin and the hemoglobin, you can actually help the laser by using, for example, in this lipoma, in order to evacuate that, in order to take it out, then you can use a marker, black ink marker. And by that black marker, I have designed where the lipoma was placed in the back of an individual. And then I have traced a line on black color, converting this black line in the so-called optical barrier, because the black color mimicking the melanin can be absorbed the energy of the laser. And by doing 1, 2 passes as indicated here at a very high power, which is the higher power emitted by the laser, but a high repetition rate of pulses, you get a so-called quasi-continuous mode of emission. And you get without bleeding, because at the same time, the energy deposited in tissue makes possible that tissue does not bleed, and then you can easily identify the areas where you're working and evacuate this lipidic problem or this disorder. But at the same time, I also can do vaporization. I can vaporize, I can destroy, I can convert in fumes the lesion by just staying there and just producing short pulses. It's not that often the pulses, and I can go modeling, I can go sculpturing the tissue and reduce this melanocytic elevated Nevi, which was in the forehead of the patient. Or I can do, for example, the other thing, which is important, I can go with these lasers and do coagulation effect, like this Venus lake in the lower lip of this patient. And by defocusing the laser, the handpiece of the laser, the laser beam, being defocused just to 0.1 millimeters, I can do the coagulation mode with only a few shots, healing very nicely and having a patient after the anesthesia recovering very well. So what I do, I can also do combination of treatment with this painful recurrent plantar wart. This wart was coming for the third time, being visited by another 2 doctors without success. And I have controlled this patient up to 3 months. And you can see how the modification after healing of the lesion here changes completely the structure of the skin, being in a much better condition when the thicker keratin, which after application of dermoabrasion was looking very nice, the condition of the skin. So in this case, we have completed the treatment using 2 different manners of irradiation. The first one, coagulation in the whole lesion in order to blanch the lesion so that I could actually lift that tissue which was no longer bleeding, and I could identify what we in medicine call easily the so-called root of the wart. It is important at that very moment that you change your focalization of your laser and you go for vaporization of that tip of this entering the skin, which produces the pain. It is important to remind you that being a viral infection Viruses cannot be cut, but can be cooked. That is the reason that we defocus the laser first for coagulation, and then later, when we lifted that tissue which was coagulated, then we can identify in the interior of the skin where the localization of the wart root is, and we can destroy that by vaporization. So interesting enough is that this can be lead to understanding the whole effects by doing trials on fruits. This is an avocado, and you can see that this laser, by intensifying the frequency of pulses, I can do cuts of the skin, mimicking the skin, this avocado layer of shell or the skin of the avocado, so to the point that I can actually lift that. Or I can vaporize the lesion, as you can see here. And at the same time, I can do, for example, because this pomegranate actually mimics, resembles the hemoglobin, and is easy to cut. But even those areas or those fruits, that in this case is an egg, which is quite white, and there is no color for the emission of this laser to absorb or to deposit the energy there, by painting this little dot here with a black marker, I can get to destroy the tissue to the point that at the same time I make it a hole on that. But not only that, I can, in case I want to use this energy of this blue laser light, I can use a marker, or for example, a carbon substance, and I can paint. I did it here in the egg, on the egg, with the color of the marker. And I'm sorry, because the film here, which was placed in the center, cannot be seen by you, but you can see that part of it is just with 2 passes I have erased, in comparison to this part that is still black in color, full color. This is being eliminated, part of it, just with few passes of the laser, which means that I'm eliminating layers of skin, so that I actually can refresh with this methodology of treatment the skin, the facial skin, or producing the so-called weekend peel, or the Hollywood peel, like as it is common called in the United States, using the carbon. It is interesting that you can see the combination of the 3 different effects as noticed here. I'm sorry that the film doesn't work, because I'm just passing with the small picture dimension. Anyway, as you can see, going back to the fundamentals of laser, thermal effects produced by the laser are very much related to time of irradiation, which actually means the programmation of the laser. As long as you are on the tissue and you start irradiating in different modalities, you can get to propagate, you can get chances to propagate the heat energy and transmit the energy, so that, or you can confine the energy by creating an optical barrier with a black color, so that you can use your laser for cutting. But not only that, we have tried the laser in tissue and a pig skin, and you can see that here the time of the pulse is longer in each one of these small slides. This is 100 millisecond pulse, 200, 300, and 400, almost half a second. But the power is the same at all time. And longer time I stay on tissue, then I can see that I get a better, deeper penetration. But at the same time, if you compare this slide to this one on the right side of the slide, then you can see that the propagation of heat, which is an eosinophilic color because of the histology staining with hematoxylin eosine, you can see that propagates very much, because I'm using longer time the tissue. Although that I penetrated more, I pay for that, a little bit of propagation of tissue. This is the reason that we need to be very careful in order to control the so-called residual thermal damage, because residual thermal damage is going to be of capital importance at the time that the tissue is going to repair, and in order to avoid the formation of scar tissue. Graphically, this could be explained in the following manner. If we consider that this is an elevated tissue on the skin surface, but I only want to eliminate part of it, which is represented here. You see, I can do it in two different manners, considering that the vertical axis is the temperature, while in the horizontal axis is the time of the pulse. Prolonged exposures means different effects on tissue. And this you can notice, for example, when I use a very high energy with a very short pulse. This will enter directly inside the area of the tissue which I want to destroy. Laser energy has been programmed to be emitting for a short time, but a very high power. Power by dimension and time, then it's going to enter the area of tissue. But I also can do this in a different manner. If I do, for example, with the lower energy programmed in the laser and a very prolonged time over a few seconds, then I can go and enter also in eliminating tissue. However, when we compare this slide to the previous one, you can see that in this one, I'm sacrificing a lot of good tissue. So the address or the moral of these two slides is that we have to use high energy and a very short pulses. And only when we want to coagulate tissue to vaporize, we have to change this parameter just to the opposite. It is prolonged time of irradiation and quasi-continuous mode because of the frequency, more frequency in the pulses depositing the energy. Here is another slide that we have produced at our lab, which is an electron microscopy. And you can notice here that I have cut with this laser here, you see? But when we examine the propagation of heat to the edges of the cut, then we can see that almost go to 1 millimeter. So be careful in using the laser with not the correct parameters, because when it comes to the time that you need to put the stitches, if you go and put the stitches within this millimeter of lesion in this area, which is already a necrotic tissue, your stitches are going to go away, because this propagation of this selective action of the thermal to the edges of the skin are going to damage the tissue, prohibiting a very good healing. So be careful in this case. In order to do correctly, you will have to use a mattress stitch to close or to approach the edges, and then just to go for a continuous stitching. Another interesting explanation of the way that this device works. For this, I have to use a CO2 laser, because when you focus actually the energy, and this could be nicely applied also to this laser, with a diameter only 100 microns, but with the incident power of 2 watts, imagine or look at here the power density that we are going to get, 25,500 watts per square centimeter. This is a lot of energy, which is going to serve us for an incision. But also, if I keep on going in a different focalization, defocusing my laser, but maintaining the incident power in 2 watts. However, the diameter is going to change. 400 microns here is going to change to 1 centimeter. And what happened is that the action on tissue is going to convert into different results. Because with this, we are doing an incision, doing a cutting. With this, we are going to do vaporization. With this energy, we're going to do coagulation. While here, we're going to photoactivate tissue, as we have noticed. So clinically, you can explain this in the following manner. Because vaporization effects in this xanthelasma, you, for example, can vaporize the tissue. This lipidic deposit here, this lipoxanthoma here, you can eliminate it nicely by combining the just by using the vaporization. But if you want to combine vaporization with cutting effects, you can also do it, because you can actually do the vaporization of the lower deposit of the lipidic deposit here, and you can cut the excess of skin, taking advantage of you cutting in order to eliminate that deposit of skin. Or you can even do the cutting and coagulation, because you can actually go by the so-called green line of the lower eyelid, and then you do a cutting, you reverse the flap of you have cut it, and then you vaporize from the interior of the tissue. So what you're doing is coagulating that fat, because coagulated very nicely when the deposit of heat. Interesting is that by doing the same experiment on a pig liver, you can see that the focalization, which is shown in a different diameter of the beam incidence on the surface of the pig liver, you can see that when you do a cut here, you see, you can notice that here, practically there's you don't notice the propagation of heat. The focus is the laser and you go for different manners. Vaporization, you extended the action of the laser, but you also damage the surrounding tissue. And in coagulation, you actually depositing heat. That is the reason that the laser with lower density of energy, but staying longer time in tissue due to the prolonged number of pulses that you use, then you reach the coagulation mode with no bleeding. However, when you go in excess with these passes of laser in delicate areas, like for example, the eyelids, you can see that you can reach to the scleral shock complication of ectropion. And this is applicable to all types of lasers. So I'm going to tell you a few hints, a few tips in order for you to realize these treatments. However, it stays to you to decide which parameters once you get to know it with precision or much better the so-called laser tissue interaction. Against this sample of fresh pig liver, you can see the way that the former laser were doing the work of cutting. You can see visually with your own eyes here in the edges, the carbonization, no bleeding, but this tissue was damaged as was demonstrated in the previous microphotography, this electron microphotography. Nowadays, if you move rapidly with the quasi-continuous mode, and also you do cutting with high energy, it almost mimics the action of an scalpel, of a cold scalpel. And I can show you here the way that a surgery can be conducted in an enormous infiltrant carcinoma, adenocarcinoma, on the cheek of this gentleman, which produces a fistula because it was attached to the parotida. And that was the reason that we used botulinum toxin injected there. And that was stopped that because the people was, the gentleman, the patient was actually dropping a little bit of water from the parotid here at all times. What happened is that with this, the secretion was stopped. So by having an idea of the all components of the skin, with the keratin, with the epidermis, where the melanin is mostly deposited, and then the other compounds in the in the interior of the skin with the collagens, the hemoglobin, the oxyhemoglobin, and of course water, you can actually go and try this laser, because by staying there longer time, even that water is not a chromophore for this type of light, you can desiccate the tissue. You can dry the tissue and therefore start with the cutting effects. Cutting effects that you can see here, for example, when I'm destroying tissue here, I can do it in a different manner. All depends on the programmation. This here laser is programmed with a focalization of 2.5 millimeters. This is just for coagulation. This is just another tissue which I'm using just for vaporization. And here is a focalization in order to use laser for cutting. Another slide, which I recommend also, which recommends also that you have to be careful, is not to press too much the spacer of the skin, because at the time of the spacer punches the skin, then you get in with the defocalization inside the tissue. This pinkish color is the glove staying on my hand, on my left hand, while I'm irradiating and pushing. You see the differentiation in the diameter of the beam. Also, you see it here when I reverse to my face, the laser, of course, without irradiation, you see the differences in diameter of that laser beam. And the same thing happens in order to cut tissue. This is a skin. This is a skin of a pig. And we also notice that we can nicely cut, and not only on the surface of the fat tissue, but also you can enter nicely here down to the muscle. All depends the way and the time, and also the programmation of power the energy, total energy, because of the diameter of the beam and the frequency of pulses. And you can also use this laser, in spite that in principle is announced to be used only for pigment, then you can use it also for doing treatment on fat tissue. Moreover, we have done trials also on patients. For example, this inflammatory acne patient suffering from a long time. You can see the differences in 2 months after 2 treatments. I did it as explained here. The parameters are shown here, and the in-between treatments that I did, after 2 treatments, then I used the tretinoin 0.5, and then at night only, and you can see the differences that can be seen here in the next slide, with a beautiful result, not only in containing or maintaining in good status this acne, but also in blanching the skin, in the qualification and the quality of skin. You dermatologists know very well, can be also very nicely obtained with the use of this derivative of vitamin A. Okay, this before and after picture of patients with darker skin. You can see that after 2 treatments, I have blanched and rejuvenate this diffuse pigmentation, especially around the mouth. It becomes really nice with this sort of treatment, and also on these lateral pictures. Interesting enough, and because this light is absorbed by melanin, and hair contains a lot of melanin, is that we notice that when patients receive the treatment, they stay for a quite a long period of time, let us say a month, without presenting any hair. You know, so we are actually epilating, although that there is not a consistency of the treatment, because we are not reaching the follicle in order to destroy the growth of the hair. We can actually peel nicely the hair. But what we have seen is that by repeating the sessions, is that we can get miniature hair and thinner hair of the thicker hair at the beginning of treatment. Therefore, we're using the treatment nowadays with this laser for going for this acne, production of acne on those isolated or random place pustules or papules or whatever. And this 3 months after 4 treatment sessions, 1 per month, you can see how patients look. What are the situations like after treatment? Well, it's a mild erythema, as you can see. I have done a marking with a black marker of the whole face, and I have passed the laser. This is immediately after presenting a redness. Clear and nice, because the radiation with this laser has eaten all the coloration, and this situation leads to the very beautiful situation. And the intensity of the erythema stays for 2 days. You see, this is the before, and this is a little erythema, but very fresh skin, brilliant and with lot of luminosity in the so-called Hollywood-like peel. Interesting enough is that when we use lower energy, for example, in order to eliminate lentigo, senile lentigo, or in the place I work now, solar lentigo, then you can see that this lentigo at the area which was irradiated and passing the laser, also because a few other lesions were there, then you can notice that the hair start growing fine and good. So you actually can use this laser, sweeping the laser on the face of the patient in whatever part in order to stimulate hair growth. Not, of course, man or this androgenic hair problem, because when it's a patient is bald, there is no solution at this problem. So in eliminating pigment, in my consideration, you have to consider the skin phototype, the density of pigment, depth of localization, is pigmented lesion is an elevated 1, or presents potential malignant signs. And for that, it's important to go for diagnosis, because laser will give you bad or irregular results if you not pass first by a correct diagnosis. And variables due to number of treatments and treatment limitations could be also depending of those melanocyte congenital lesions that are very deep placed, which the laser cannot reach, and we risk to have just scarring problems. But in light skin colors, you can get to nice results, and also treating in a different manner this lentigo and the whole face using the area. but also in a more extended pigmentary disorder, you can actually combine with other treatment. And even in darker people, you can combine, for example, with the erbium jack laser with this other 445 nanometers blue light laser. But you can go to darker skins. We can treat, for example, patients with this Hollywood black ink 445 black laser peel. You can do in different treatments. You see after the second treatment, you can see the differences. Very nice, very good, and patients are very happy. And moreover, we have tested also the possibilities of this laser. This slide, I'm sorry, should be on the left side, and this one should be on the right side. I'm noticing now, because you can see the interfibrillary spaces in dermis with an almost flat epidermis and very no dense collagen, as you can see here, and a very wavy epidermis. This wavy epidermis, which is characteristic of the younger tissue of the younger person or the younger skin.
Sorry to interrupt. We have only 10 more minutes left, sir.
I only have 2 minutes more, and then I will be finishing. Thank you very much anyway for your
Thank
advice.
you.
Okay, this is a melanocytic Nevi when it's elevated. You see, like in this case, for example, you'd have the histology of this situation, you know, with the theca entering the dermis, and you can use also a different staining in order to see the positioning of the melanin in tissue. And in order to get rid of it, you cannot go superficially. You have to keep on going until you find that most of the pigment is going away, and you can get good results. And as you can see here, if you take properly care of your patient post-operatively, and it gives you very decent results. In this hairy melanocytic Nevi, this is going to disappear. This is traces of the halo. So the statements that I can conclude my presentation is that selection of laser settings is not a random decision. You have to know laser tissue interaction. But if you decide and you know how to use these parameters, I can assure you that you can go and obtain good outcome with all your treatments, provided that the patient follow also the results. And again, if you are careful with your treatment. So standardization is the key. And the standardization means programming correctly the laser. Prescription of treatment without diagnosis is important, of course, is prone to failure. Laser power, pulse width, and its repetition rate in hertz are essential for a successful outcome. And the last slide, treatment and depth of pigment in skin predicts efficacy of outcome. Of course, because if the placement of the pigment is too deep, then it's more difficult to be secure when you have reached enough depth in order to eliminate all the pigment. Derm cosmetic creams as maintenance treatment are excellent recommendation to avoid recurrences and to keep a good skin condition characteristics. Lasers are not an alternative for elimination of congenital melanocytic and hairy Nevi. This is the conclusion after 40, 50 years that we have the laser in use, because laser actually was created, was founded, or was formed in 1960. So by now, it's 60 years since the laser exists. And no communication has been reported saying that the use of lasers to treat congenital melanocytic Nevi or hairy Nevi can get to a malignancy. But moreover, it's a treatment option nowadays as it is worldwide considered. Shukriya.
Thank you so much, sir, for this wonderful talk. Anurag, you have another 5 to 7 minutes if you have any queries with Dr. Trellis, and we have to wind up for the next session.
Sure,
Thank you very much, Dr. Madhuri. I appreciate your help and also your patience.
Thank you very much, Madhuri. Well, I do have a lot of questions because this is a fantastic technology. But of course, constraints of time don't let us do that. But still, Dr. Mario, I would like to start by asking you that we are going to be talking about predominantly type 4, type 5, type 3 kinds of skins. And treating this particular skin type with the blue laser, what are the chances of post inflammatory hyperpigmentation? Because I did notice the congenital nevi on the right, on the neck, did leave a scar and a hyperpigmentation. So how do you
appreciate it. I appreciate it very much, your question. And you see, nowadays we are doing not trials, but a formal study on treating dark skins, skins 5 and skin 6 that we encounter in Dubai, where I work at the moment. What we do in those cases is we actually start preparing the patient no more than a week before the treatment, just with the regular combination of vitamin A and also in combination with the 2% of hydroquinone. Patient should use it at night and in the morning. It really, the patient comes to us a little bit fresher with the percentage of skin fresher. And then at that moment, we go for it. And as soon as the crust goes away, then she restarts the treatment for a period of 15 days. That is when they persist the status of the inflammatory process that could activate production of melanin, but melanocytes. And so far, we have treated already 12 patients, but we consider it a still short time because the study did commence just 1 month ago, but we have noticed that no pigmentary disorder have appeared. Moreover, redness in the area where we have used the laser.
All right, so I guess a little word of caution that we need to exercise control over what we're using. Quickly going on to your usage of this laser in the vascular lesion. So is it only for very superficial things like cherry angiomas, or you can go ahead and treat deeper vascular malformations like hemangiomas as well?
I would say that this laser being absorbed by hemoglobin, for example, because you have, say, hemangioma or any elevated vascular lesion, I think this is an ideal tool in order to do that. But you have to do it in a proper manner. You have to defocus the laser. You don't need too much energy, and you need to stay on the lesion in order to get the effect of coagulation. Please, I would like you to remember that at the beginning of my talk, I was started the trials with this device in order to use it only for acne treatment. But because of our experience, we noticed that with this device, just by modifying the time of staying the energy on tissue, you can modify the 3 different effects and obtain nicely. Of course, if you don't have the chromophore, by staying longer time with a source of heat, then you are going to get results. It is not going to be perfect as, for example, the cut of a CO2 laser. It is not going to be an ablative laser like, for example, the erbium jack laser. However, and in the case that you're doing small lesions in some areas which are not that visible as it is the face, I don't have any problem in treating those lesions, for example, in the body. I have treated large already collection of fat, as this lipoma, and it was working very nicely, the healing of the skin.
So do you think that this could be an alternative to PDL lasers, or it is still way ahead? The PDL is still way ahead.
Again, your questions are very nice. I appreciate it. Well, I think this is a laser that can be, being a portable laser, only 3 kilos, you see, you can take it with you anywhere, you know, you can actually move the laser just under your arm and even take it home, you know. I mean, you can go for a walk with your laser, not to treat patients in the street, of course not, you know, but it's a laser which uses and with the enormous capabilities and the variation of indication, variety of indications, then you can actually have a unit which is complementary, if you want, to another laser that you may have at home, okay, at your clinic.
All right. So it was very interesting to see your treatment of acne patients. So what is the mechanism of acne treatment of this particular laser? And which particular grade of acne do you think that this laser would work the best?
This is also one of our targets, because in acute situations of acne, this is the preferable indication for this device, because you blast the fistula and then you enter in a secondary action inside the little hole in order to disinfect the action. Then it's formed crust, the little scab there, which is going to go away in about 3-4 days, and then doesn't get any residual problem. We don't see any longer such a prolonged erythema situation that are typical of this acne when it's in an inflammatory and it's in a pustula formation. Okay.
So can it be?
But we are not going. Sorry for interrupting. But we are not considered that this laser goes against the cause of the acne. You see, we have to investigate the type of acne, and according to this, we have to repair the basic problem, the origin of that. That's the reason you also notice probably that I have been using in between sessions the tretionine. I never learned the name. Tretionine, we call in Spain.
Yes.
Anyway.
And do you have any experience of combining this laser with patients who are already on isotretinoin, the oral isotretinoin?
Yes. I think it's a good complement and it's not contraindication. I would say that this I could call invention of idea that lasers for ablation or for treatment cannot be used when the patient is under vitamin E treatment as retinoid. You know, no. I haven't seen any problems so far whatsoever, and I'm being with lasers. You cannot see now my face in detail, but I'm with lasers since 1973. Although that we started from the basic of lasers investigation at the lab, you know, since I'm using formally the laser in my action in the early 80s, I haven't seen any problem in doing resurfacing, for example, in patients treating already with vitamin A. Okay.
All right. Thank you very much, doctor. It's a fantastic thing. One last question, Madhuri. I just want to give it to Mr. Fernando. Mr. Fernando, you're online. Can I have?
Yeah.
So you have done a fantastic job with giving us very compact and powerful machines. What is the technological advantage you feel these machines have over the bigger machines? Also, your this Blauman laser has got a vertical cavity surface emission, which is also used in your Milesman diode. So how do you go about it and how do you compare? A very quick word because we are short of time. This is the last question.
Okay. Having a portable technology is a thing that we are focusing so much now. We think that miniaturization of the technology is something that is really difficult to get. It's not synonym of powerless technology. On the contrary, right now you have other types of technologies such as iPhones, laptops are really powerful, and they are very small. So the reason of the advantages of having a portable technology is that you can share among different practice or offices. And in addition, whenever you have a technical problem, you don't have to forget that we are working with machines. So by having a small technology, you can move quickly to the technician, so you don't need to spend time waiting for the technicians to come. So that's the reason where we have been insisting so much and focusing so much on portable technology. Again, it's very difficult. It's much more difficult manufacturing small technology than large technology, but we consider that there are a lot of advantages, such as traveling with the machine, or if you have different practices, you can work with it. The second question about the Dixo technology, that is the vertical cavity surface emission laser, it's something that it's regarding to the compact, Milesman compact, and this is just to get like a good homogenization of the energy. So we saw that because of some optical problems by using prism, so the energy was focusing in the middle of the spot. That was increasing the risk of burning and increasing the risk of having a painful treatment. So if you are able to distribute the energy all over the spot, all over the area you are treating, so you are going to reduce what we say the hot spot. You are not going to have hot spot, but you are going to have a very homogeneous density. So that's the two points that you are asking me.
Thank you very much for this. And I know that good things come in small packages. This has been an age-old proverb. And thank you for making it true again for us. Thank you very much, Mr. Fernando and Dr. Mario. It was a pleasure listening to you and learning a little bit more about this new laser. I look forward to having it in my clinic and possibly using it for some time. Over to you, Madhu.
May I say just one, the last thing said. There is one question. There are some people asking what's the difference between using LEDs and blue laser. So the LEDs has a very low density. Okay, so we are not coagulating anything. We are just killing bacteria or just performing in a different way. So what we are doing with the blue laser is that we are coagulating the infected lesion, the inflammatory lesion. So we have high density. With this high density, we are able, as Dr. Mario was saying, we are able to coagulate the lesion and to speed up the drying of the lesion. So that's the thing that we can get with LEDs. But in addition, because it's a blue laser, I'm finishing my last sentence. Because it's a blue laser, we are getting as the LED. We are at bacteria. It's a bacteria killer. So we are getting the same effect as the LED, but in addition, we are able to drive and to speed up the healing of the lesions in the acne.
Thank you, Mr. Fernando and Dr. Trellis, and thanks Anurag for conducting the session beautifully and sticking to time. Thank you so much. And we are sure that we'll all have this machine in our clinics if doing well. So fantastic. And so look forward to that. And we close the session here. Thank you, everyone.
Thank you. Bye.
Bye-bye.
Thank you very much. I'm very happy to have this time with you.
Thank you, Dr. Trellis. Thank you.
Thank you.
Pavani, thank you so much.
Thank you, Dr. Madure.
Thank you.